Most men have never heard of this, and the ones who have don't talk about it. But there's a spot on your body, one single point, that sits right at the crossroads of your blood flow, your nerve function, your prostate health, and your sexual performance. And if you've been ignoring it your whole life, which most men have, you've been ignoring one of the most powerful levers your body has for healing and restoring function after 50. We're talking about the perineum. And today I'm going to walk you through exactly what it is, why it matters so much, and a simple massage technique you can do in 60 seconds that can start changing how your body works from the inside out. Let's start with the anatomy, because once you understand what's actually happening in this area, everything else I'm about to tell you makes complete sense. The perineum is the area of skin between your scrotum and your anus. That's it. Simple location. But what's underneath that skin is anything but simple. According to anatomy research published through the National Library of Medicine, the perineum is what's called a neurovascular convergence point. That means it's where a massive concentration of blood vessels, nerves, and muscles all come together in one small space. The primary blood supply runs through here via the internal pudendal artery, which is a major branch of your internal iliac artery. This artery feeds directly into the cavernous arteries of the penis, which are the exact arteries responsible for delivering blood during an erection. The primary nerve running through this area is the pudendal nerve, which originates from spinal segments S2 through S4. This nerve controls sensation in the penis, motor function of the muscles that maintain erections, and contributes to ejaculatory control. Pelvic floor muscles like the bulbospongiosus and ischiocavernosus, which are directly responsible for erectile rigidity, attach right here at what anatomists call the perineal body. So when you massage this one spot, you're not just touching skin, you're stimulating the convergence of the blood supply, the nerve trunk, and the muscle attachments that govern your sexual function. Now here's what happens after 50 that makes this so important. As men age, pelvic floor muscles lose tone, blood vessels lose elasticity, nerve signaling slows down. Posture changes from years of sitting compress the tissues in this region. The result is reduced blood flow to the perineum and the structures it feeds, increased nerve compression, tighter muscles that can't relax properly, and a cascade of downstream effects that show up as erectile dysfunction, reduced sensitivity, bladder issues, and chronic pelvic tension. The perineum becomes what you might think of as a traffic jam. Everything that needs to flow through this area starts getting backed up and sluggish. Massage doesn't just loosen a muscle. In this case, it's clearing the traffic. Finding the right spot is straightforward. Sit or lie down in a comfortable position. Use your index and middle fingers and place them on the area of skin between your scrotum and your anus. You're looking for a spot that feels slightly indented or tender when you press gently. That tender feeling is normal. It means you found the area where those muscles, nerves, and vessels are converging. Some men find it immediately. Others need a minute or two of gentle exploration. Don't force it. Just feel for that spot where the tissue responds to light pressure. Here's the technique. Once you've located the area, apply moderate pressure. Think about the pressure you'd use to test whether an avocado is ripe, firm enough to actually engage the tissue, but not so hard that you're causing sharp pain. Now move your fingers in a clockwise circle. Small, controlled circles. Do this for 30 seconds, then reverse direction and go counterclockwise for another 30 seconds. That's your 1 minute. If circular motion doesn't feel natural to you, there are 2 alternative patterns that work just as well. The first is a simple up and down stroke along the perineum, moving from closer to the anus toward the scrotum and back. The second is a press and release pattern. You press firmly, hold for 5 seconds, then release completely for 5 seconds. Repeat that cycle for the full minute. The press and release method is particularly good for releasing what are called trigger points, which are knots in the muscle tissue that restrict blood flow and create chronic tension. Now let's talk about oil, because this is where the practice goes from good to significantly better. Massaging dry skin in this area is uncomfortable and can cause friction damage to sensitive tissue. Using the right oil does two things simultaneously. It makes the massage smoother and more comfortable, and it delivers therapeutic compounds directly into the tissues you're working on. Castor oil is the first choice, and here's why. Research going back centuries and confirmed by modern studies shows that castor oil penetrates deeper into tissue than almost any other topical oil. Its primary active compound is ricinoleic acid, which is a powerful anti-inflammatory. When you apply castor oil to the perineum and massage it in, the ricinoleic acid is being absorbed into the exact tissues where inflammation and restricted blood flow are causing problems. Studies out of the University of Texas confirmed that castor oil packs stimulate lymphatic drainage and improve circulation in the tissues they're applied to. That's not a small deal when you're targeting an area that's already compromised by age-related changes. Coconut oil is the second option, and it's a better choice if your skin in this area is particularly sensitive. It's lighter than castor oil, absorbs quickly, and has its own anti-inflammatory and antimicrobial properties. It won't penetrate as deeply as castor oil, but it's gentler and works well for men who are just starting out. Black seed oil, which comes from the Nigella sativa plant, is the third option, and this one has a specific hormonal angle that makes it interesting. Research published through PubMed, including a systematic review of 24 studies, found that Nigella sativa can improve reproductive parameters and support testosterone levels. A study from Jordan University found that black seed oil administration led to significant increases in testicular function markers and serum testosterone. Now, the research on black seed is still developing, and some of it has been done primarily in animal models. But the anti-inflammatory and antioxidant properties are well established in humans, and when you're applying it topically to a region where inflammation is suppressing function, those properties matter. The downside is cost. Black seed oil tends to be more expensive than castor or coconut oil, so it's worth using strategically rather than as your daily base. Here's what works best in practice. Take castor oil as your base, about 1 ounce. Mix in coconut oil if you want to lighten the consistency. Then add 3 to 4 drops of an essential oil for added benefit. Peppermint oil increases local circulation and has a cooling sensation that many men find feels good on this tissue. Rosemary oil has been shown in research to support blood flow when applied topically. Sandalwood oil has anti-inflammatory properties and a calming effect that supports the relaxation response. You don't need all three. Pick one that appeals to you and stick with it. Quick pause right here. If this is resonating with you, if you're learning something you didn't know about your own body, hit that subscribe button, like the video, and share it with someone who needs to hear this. All right, let's keep going. Let's talk about timing, because when you do this, matters as much as how you do it. Morning or before bed are the two best windows. In the morning, you're giving your body a fresh start. The massage increases circulation right when your system is waking up. And the anti-inflammatory compounds in the oil have the entire night ahead to work while you sleep. Before bed, you're pairing the massage with your body's natural repair cycle. Sleep is when tissue healing accelerates, and you're delivering therapeutic compounds right into the tissues that need them most during those hours. If you're dealing with specific sexual performance concerns, there's one more timing point worth knowing. Performing the massage 2 to 3 hours before intimacy can prime the blood flow and nerve responsiveness in the area without overstimulating it. 2 to 3 hours gives the increased circulation time to settle into a steady state rather than a spike. Now let's talk about how to build this into a routine without burning out on it. Start every other day for the first week, 1 minute per session. That's it. You're not trying to transform anything in week 1. You're training your body to respond to this kind of targeted stimulation. After that first week, move to daily practice. 1 to 2 minutes. Some men find that doing it twice a day, morning and evening, accelerates the results. If you experience soreness after a session, that's your body telling you the pressure was too aggressive or the frequency is too high for where you are right now. Back off to every other day and reduce the pressure. This isn't a situation where more is better. The progress here is cumulative. It builds over weeks, not hours. Here's something important about the breathing that goes along with this. When you're doing the massage, breathe deliberately. Inhale for 4 counts, hold for 4 counts, exhale for 4 counts. This pattern activates your parasympathetic nervous system, which is the branch of your nervous system responsible for relaxation, tissue repair, and blood vessel dilation. When you combine the physical stimulation of the massage with parasympathetic activation through the breath, you're telling your body on 2 levels simultaneously that it's safe to relax, to increase blood flow, and to let the tissues in this area open up. Men who add the breathing pattern consistently report noticeably faster results than those who just do the massage mechanically. Let's talk about the broader picture of what this practice actually does beyond the perineum itself. Pelvic floor dysfunction in men doesn't stay in the pelvis, it radiates. Chronic tension in the perineum and pelvic floor contributes to hip tightness, lower back pain, and even prostate irritation. Research from physical therapy studies confirms that men who address pelvic floor tension see improvements not just in sexual function, but in urinary control, bladder frequency, and overall pelvic comfort. Several men report that nocturnal urination decreases after consistent perineal massage because the chronic tension that was keeping the bladder in a state of partial contraction starts to release. Athletic performance can improve too, because core stability depends on a functional pelvic floor. If the foundation of your core is tight and dysfunctional, everything built on top of it, your lower back, your hips, your ability to generate power, is compromised. And there's a mental health component here that's worth naming. Chronic pelvic tension is linked to elevated stress hormones. When you release that tension through targeted massage and conscious breathing, you're not just fixing a physical problem. You're reducing the physiological stress load on your entire system. Men who practice this consistently report improved mood, better sleep quality, and a general sense of having more energy and mental clarity throughout the day. That's not coincidence. That's your nervous system finally getting permission to downregulate. Here's one mistake that trips up a lot of men who try this. They go too hard too fast. They read about the benefits, they get excited, and they start pressing with full force on day 1. That doesn't work here. The perineum is sensitive tissue with a dense nerve network running through it. If you overdo the pressure, you're going to cause inflammation instead of reducing it. You're going to trigger a pain response that makes your nervous system tense up harder, and you're going to discourage yourself from continuing. The approach that works is gentle, consistent, and patient. Start lighter than you think you need to. Let the tissue tell you when it's ready for more pressure. It'll take a few sessions before you feel the tissue start to soften and respond. Once it does, you can gradually increase pressure over time. Another common mistake is skipping the oil entirely. Some men think it's unnecessary or feel awkward about it. Don't skip it. The oil isn't optional here. It protects the skin from friction damage. It delivers anti-inflammatory compounds directly into the tissue, and it makes the massage feel good enough that you'll actually keep doing it consistently. A practice you enjoy doing is a practice that sticks. Here's your 30-day plan. Days 1 through 7, every other day, 1 minute per session with castor oil as your base. Days 8 through 30, daily, 1 to 2 minutes per session. Add the 4-4-4 breathing pattern from the start. Track how you feel. Not just in terms of sexual function, but energy, sleep, pelvic comfort, lower back tension, and mood. The changes won't all show up at once, and they won't be dramatic overnight. But by the end of 30 days, most men notice something has shifted. The tissue is softer. The blood flow feels different. The tension that used to sit there all day starts to ease. And for a lot of men, that's just the beginning. This isn't a gimmick. This isn't something that came out of nowhere. The perineum has been recognized as a therapeutically significant point in traditional medicine systems for thousands of years. Modern anatomy and physiology research has confirmed exactly why. It's a convergence of blood supply, nerve function, and muscular attachment that directly governs erectile health, urinary control, and pelvic stability. Massaging it with the right oil, the right pressure, and the right breathing pattern is one of the simplest, most cost-effective things you can do to support your body as it ages. No pills, no procedures, no side effects, just your hands, some oil, and 60 seconds of your time. Your body is still capable of healing and adapting. The tissues in this region respond to consistent, thoughtful care. The blood flow can improve, the nerve function can sharpen, the muscles can release. But none of that happens if you keep ignoring this area entirely. Start tonight. Start tomorrow morning. Just start. I'm Dr. Melinda Wright. See you in the next video. Drop in the comments below and tell me what you want me to cover next. I'll do my research and make a video on it. Subscribe, like, share.